Vigland on the Majority Report. It is Casual Friday. Joining us now, my old friend from back in the Air America days. Well, really, actually, even like Boston days.
Back in the poker days when we actually played poker.
But when people would do that, they didn't even know, like, use cards, like actual physical cards. She's co-creator of The Daily Show and founder of the Abortion Access Front. Lizz Winstead, great to see you. Thanks for being here.
Oh, so glad to be here and talk to you. It's crazy.
You have been working in that space of helping women, particularly in states where there was sort of like a de facto ban on abortion in terms of access, not necessarily from a legal perspective as much as like just there had been so much to undercut the woman's right to, or a person's right to get abortion services. You've been doing this for years now. Just tell us about what the Abortion Access Front has been doing, like, literally, I guess.
So literally what we have been doing is we have been traveling around the country. We've been to 45 states, every shitty state you never want to go to. And we put on comedy and music shows and create this platform for the providers and the activists in these towns to be able to talk to our audiences. And then we set up booths within the space so that you have 300-400 people in a room who didn't know what was going on before. And then they sign up so that they can hear directly from the clinics and the activists what needs to get done locally. And then they can take action with them. And then we also do this wild sort of Habitat for Humanity thing where my team at Abortion Access Front is made up of not only comics and producers, but also activists who have mad skills at like gardening and painting and like fixing shit. So we go to a clinic, especially these small community clinics, and we'll like fix their fence or paint their whole clinic or do their gardening. Because what folks I don't think realize in this larger picture of oppression is that if you provide abortion care in a hostile community, you can't get somebody to come and mow your lawn, fix your fence, do shit that any small business would have no problem getting to do, right? So at our shows, after we've sort of done this like, short-term fix, we tell the audience what they need on the regular. And 99% of the time, we hook up that plumber or that landscaper with the clinic. And then they understand that activism a lot of times is parking your company van in front of a clinic and providing that care, saying, I'm happy they're in my community and I'm happy to provide service for them. So that's like the big stuff we do. Secondarily, we do a lot of data mining where we have created the largest anti-abortion database in the country. We track anti-abortion extremists and then connect them to Oath Keepers, 3%ers. And when January 6th happened, we'd been tracking them for so long that we pulled 30 people videos from January 6th before they got to take them down and turn them over to the FBI.
Wow.
Yeah.
Well, I want to just touch on that first thing, because I think that's such a great model for, it seems to me, like all sorts of activism, and people don't, I think, really fully appreciate and don't always use the value like that's associated with bringing in whatever kind of show it is, but any type of performers, because you're getting people there, and campaigns do this. That's why they get a top star to come and appear at a campaign rally, because he's going to bring in other people. But the way that your organization has been sort of like creating mini organizations, essentially, like these mini mutual aid type of situations, is really fantastic. But what do you do now? Because those abortion clinics in anywhere from, probably as of today, 10, but within the next several months, probably closer to like 25 or 26 states across the country abortion is going to be illegal. So like how do you shift now? What's the plan?
Well, the ping ponging is really intense, Sam. And like, even in the states where it hasn't fallen yet, Doctors are terrified to provide care. If there's any kind of bounty law in place, the abortion funds are terrified to help fund people. So there's clinics like Whole Women's Health, which is an incredible clinic, and I have to say I'm on the board, so as I plug, but they are the ones that brought the lawsuit. There in Texas, and they're in 6 other states. They're fundraising now to open a clinic in New Mexico. There's a clinic in Bristol, Tennessee that's moving to Bristol, Virginia, which is one of those dividing lines within the middle of the city, moving over to Virginia, which is for now a safe state. North Dakota, moving to Minnesota. So those things are really happening, but people are also skittish to provide care to somebody who's coming from a red state to a state that provides, because they don't want them to go back to their state if they take medication abortion, because could they be liable? They don't know. So it's a mess. So what we do now is, a couple of things. I think that what we're doing actually is we want to have people understand all the ways that you can help right now, whether that's volunteering or fundraising for an abortion fund or a practical support fund. And those two things are different. The practical support folks are the ones that fund everything but the abortion, the travel, the lodging, the childcare, all of that. Those two things are going to be crucial. And how they need to expand their activist spaces is for them to decide. And as this is all unveiling, they're going to have a lot of information to help out, right? How do we actually deal with our state legislators, because it's just, let's be clear, Sam, the platitudes. I'm way more mad at the sort of complacency of Democrats and liberals than I am about the, anti-abortion White Walkers that we know exist, right? It's like, it's been so hard to convince people, politicians who are Democrats who say they're pro-choice, to actually fundamentally understand the humanity around denying somebody medical care that determines how they determine their life, like for real, and they don't fight for it to the necessary level that it deserves. So there's a re-education process right now so that people will actually not only just say I'll back shitty laws, but I will actually create abortion forward laws. And so, helping people really understand how to lobby and how to actually talk to politicians and demand of them that they need to vote on abortion care and reproductive care as though it's a civil right, because it is. And then really helping people take out into the streets and do effective direct action. Our movement has started to really groundswell with Abortion Access Front and organizations like Shout Your Abortion and Thank God for Abortion. If you'll notice, they all have abortion in the title because saying abortion's crucial, but really developing direct action organizations that have that act up feel, where you are taking action that matters, that you are calling out the people who are being the most oppressive, centering the bad guys rather than yourself, so doing that kind of stuff is really key. And then letting people know about where all these places exist, because the one thing that can be really harmful with doing abortion in general is if you provide care or try to fund abortions, you get death threats. Full stop. That is your jam, right? And so don't start something on your own. There's tons of really cool organizations doing the work, but because they're so overwhelmed doing the work, they don't have time to elevate the work. So that's where we come in.
The when you say White Walkers, right? It's a funny way to put it, because like there seems to have been, what's most jarring about the grieving process that I'm kind of going through with this is how Democrats for my entire lifetime have been campaigning on, or they haven't said the word abortion, but the leftier Democrats, there's always been an understanding that if we lose the Supreme Court, we could lose Roe v. Wade. This is a precarious situation. And so that's been fundamental to like my political education. But now that moment has come, and they're acting like, it's we don't have a plan. Like, we haven't been able to see this percolating, basically. And that is just such an odd response to me. I mean, I know your organization probably has just so many things in place already because there was an understanding that with this conservative Supreme Court, this was coming. Like, but for local officials in the states that you're operating, Democrats, maybe allies, what has been shocking to you about the I guess the lack of preparedness for we've seen it on the federal level, but on the local level for what we all knew was very likely to happen?
Well, you know, it's like our side didn't even figure out midterm elections until 2006, right? Like, forget about it. We were just complacent in off-year elections. And so I think that the state, I don't think people fundamentally understand that the state politics are really where things are happening, and the court system with which they go through before they even get to the Supreme Court is where things are happening. And so I think that the biggest surprise, honestly, and I have been focused on this for 10 years, is it wasn't enough. They're sore losers in a way that, you know, Adam Serwer always says, you know, the cruelty is the point. And I feel like they're almost like zombies who just have a feeding frenzy on cruelty. And then when the satiation goes away, they have to create a new way to be cruel. And so I think I underestimated the cruelty of what this looks like and the hatred of what this looks like. And I think that we all did. You know, I knew that the end goal was retain power and all that, but man, that has been the thing that I think gobsmacked everybody.
What are you guys, or what are you aware of? Is there any organizations out there or any mechanism? I mean, you said you were collecting data on the people who attack these clinics, right? And who are threatening these clinics. But what about the data? There's going to be a whole new class of women now, and people who have uteruses, I guess, who are going to be denied health care for things where the health care would appear to be an abortion or close enough that it's going to inhibit healthcare providers from providing that healthcare.
I love this question.
And on top of that, also, you know, like the exceptions of a woman's, of rape or incest or of a woman's life, that's also meaningless because, you know, a doctor can't assess whether someone's been raped enough to prove it in a court of law in time to provide an abortion. They can't do the same with incest. And like no one has developed a scale as to what constitutes a threat to a woman's or a person's life such that it reaches the threshold of a non-prosecutable abortion. So there's going to be like, and we could be talking about anywhere from 40 to 100,000 people a year in this situation, maybe more.
Well, yeah, Sam, I mean, let's just think about that for a second, right? Some stuff that people don't really think about. For example, in some red states, because of the reporting laws, if you went to your shrink and said, I'm pregnant and I'm thinking of getting an abortion and I really need to figure this out, they may have to report you to the authorities. There are antidepressants and antipsychotic medications that are considered abortifacients because they've been doing studies that sometimes between 2 and 5% of the time, people who are on some of these drugs will miscarry. So is prescribing life-saving medication for somebody dealing with mental illness, is that going to go away? And then that's going to cause possibly suicide, right? So you think about cancer treatments that would harm the fetus, lupus, arthritis. There's medications that people take where the risk is miscarriage, and doctors are terrified that they're going to be prosecuted and have their license yanked because they prescribe those things. And it's...
Or go to jail.
Right. Go to 10 years, fines. your whole life's work is gone. You know, we all heard about the 10-year-old in Ohio. You know what people don't think about that 10-year-old in Ohio? If there's abuse, there's a good chance that in cases like that, the 10-year-old is immediately taken from their parents' home and put into the system. If that happened in Ohio, a state that doesn't provide abortion in any case, that child doesn't get the care. That child's under state authority.
There and Ohio is not going to bring that child to Indiana to get that abortion care.
That is correct. Neither probably would have foster family.
So all these things are going on.
Yes.
And we were just talking with Alex Perrine that we have a dearth of local reporting as it is, you know, and which is not to say that that would necessarily be picked up by a local reporter, but is there, I mean, who out there is like developing the VAERS system, you know, the equivalent of the adverse reactions to vaccines that anybody can go and put their own thing? Who out there is starting to collect these stories? Because, you know, we know about that 10-year-old in Ohio because it happened to hit the news, but it wouldn't shock me if there was 3 others of those cases.
There's a jillion.
In this past, you know, in the next 30 days, where they're going to be like that, we're not going to hear about.
Well, so I will recommend and self-plug. I have a podcast called Feminist Buzzkills Live, and on my co-hosts are Moji Alawodale, who is an activist and works with Made Abortion Access Front, and my other co-host is a woman named Marie Kahn, who works for the Midwest Access Coalition, which is one of the largest practical support funds in the country and travels these people all around, right? So as we get stories from the folks on the ground, we're telling people those stories. So if you want to hear weekly, not just what's in the headline, but what those ramifications are and where these stories are, definitely listen to our pod. The other thing that we're trying to do is we want people to understand where they can elevate and learn and apply their own capacities to this fight, right? Not everyone's going to run for office. Not everyone's going to be able to do things, but there is a myriad of ways that you can actually elevate and help. And so on July 17th, we're doing this massive live stream show where we're bringing the coolest people from around the country to have a series of panel conversations about the different areas that you can activate. And then in between each panel, we're asking people to watch, have house parties. We're giving you a toolkit of things to ask your own selves, brainstorming ways that you can help. And then this is crazy. At the end of the day, we are vetting every single person with Digital Defense Fund and some other security teams to make sure they're not trolls. And then we're going to hook up everybody who watched to where they said their interests lie locally so that we can bring people together. And then we have this, once you've been vetted, we have this live activist calendar that's got national events, but also local events. So you can do a pull down to say, I'm in Toledo, things that I can do within this radius so that people can always remain activated, know who to contact in their community, and they've been vetted by trusted sources.
Well, that's amazing. And so, you know, we've had many people, you know, both via the show and calls and IMs, but also in, you know, my personal life, people are like, you know, what do I do? And this is a great opportunity to figure out what you can do there. So,
and the cool thing is, it's July 17th. If you can't make that day, we're making the trainings and the toolkits available to you after the fact. You just have to get vetted. And we vet people, and people are like, what do you mean? You have to get my email and social media. Let me tell you, we cannot introduce anybody to be part of this movement unless we make sure that you are not somebody who wants to cause harm. It's really just crucial to know that we just want to find out what your email is and the city, state you live in. And if we can verify you on social media to make sure you're not a bot or not an anti-troll, like, let us do that. It's the least we can do. It's your shit safe.
Very important. I mean, particularly we're talking about, you know, some of the most, you know, vulnerable people out there. And so,
and also the intersections, as you can only imagine, Sam, and probably already know because you know so much, but like the intersections of anti-abortion extremism and white supremacy, it's a circle, right? I mean, I'd love to come back and talk to you about the kids' violent training camps that they set up to teach kids how to have guns through their churches, all this kind of stuff that we've uncovered. It's a whole nother thing, but it's super fascinating.
I would love to have that conversation. I've always contended that, like, you know, that racist folks and misogynist folks do not perceive themselves as like, well, you know, I don't like black people.
I'm a
but
single
I
issue.
really
I'm a
do believe-
single issue bigot.
Right. Well, I mean,
Yes.
like, they just don't make a distinction. I was saying this in the context of, like, you know, how is it possible that someone could, you know, vote for Donald Trump and Barack Obama? Well, it's because they're like, we're not going to have two non-normal presidents in a row. Like, it's just, it is, they're just perceiving other people as being fundamentally different from them. And if they're a white male, that means, you know, if you're anything other than white, and if you're anything other than male, you're on the other team, as it were, and that's it. But Liz, we're going to put a link to and what site can they go to for more information on July 17th? We'll put a
It's
link
really easy. OperationSaveAbortion.com. You can find out all the information there.
All right, we're going to put links to that in the podcast and YouTube description. Liz, great to see you. And
So great to see you. Thanks for having me on. I
good
super
luck with it.
appreciate it. Thanks.
All right, folks, we're going to